Birth control, also known as contraception, is designed to prevent pregnancy. One such drug, which is commonly used nowadays, is Sencromen, which is marketed under the name CHAYA. So friends, let's have a brief discussion on CHAYA. Sencromen is a non-steroidal oral contraceptive. It is a selective estrogen receptor modulator. It was synthesized at Central Drug Research Institute, Lucknow, and was introduced in Delhi in 1991. It is marketed in India under the brand names Saheli, Centron, Novex DS. It was included in the National Family Welfare Program in 1995, and since 2018 it is available free of cost in the government-run family welfare centers under the name CHAYA. So who can take CHAYA? It can be safely used by women of any age or parity after ruling out pregnancy. Women who had side effects with combined oral contraceptive pills can also opt for this method. It can be used by postpartum women who are breastfeeding, as it does not affect the quantity, quality, and composition of the breast milk. How to take this drug? Each pack contains 8 tablets. Sencromen 30 mg tablet is taken twice a week for the first 3 months, followed by once a week thereafter. For the first 3 months, the first pill is taken on the first day of the menstrual cycle, and the second pill is taken 3 days later, that is, on the 4th day of the menstrual cycle. From the 4th month, the pill is taken once a week on the first pill day, and it should be continued on a weekly schedule regardless of the onset of the subsequent menstrual cycles. This chart shows the CHAYA days. For example, if the first day of the menstrual cycle falls on Sunday, the patient has to take the drug on that day, and after 3 days, that is on Wednesday, she has to take the second dose. This has to be followed for the first 3 months. After 3 months, the patient has to take the drug only once a week, that is on the first pill day, that is Sunday. So according to the day of onset of the menstrual cycles, this chart can be followed. Pharmacodynamics of this drug. The drug has got more affinity for estrogen alpha receptors when compared to estrogen beta receptors. It has got no effect on other endocrine glands. It has got mild estrogenic action on vagina, bone mineral density, central nervous system, and serum lipids. The drug has got estrogen antagonist activity on the uterus and breast. How does Sencromen act? It has got an anti-estrogenic activity on the endometrium, inhibiting the fertilized ovum from implantation. It hastens the transfer of zygote from the fallopian tubes to the endometrial cavity before it is ready for implantation. So, there is an asynchrony between the developing zygote and endometrial maturation, leading to the failure of implantation. The most important point which has to be stressed is that the ovulation is not affected by this drug. What are the uses of Sencromen? It is primarily used as a contraceptive, the other uses being dysfunctional uterine bleeding, and it is used for the treatment of mastalgia and benign breast diseases, for advanced breast cancer and osteoporosis. What are the advantages of Sencromen? Convenience of infrequent dosage as compared to other hormonal contraceptive pills. It does not have the side effects which are commonly seen with hormonal contraceptives. It has got quick reversibility of fertility when stopped, and also has got excellent therapeutic index. It has shown potential as postcoital contraceptive. There is no congenital or developmental anomaly which has been reported in births in cases of contraceptive failures. Adverse effects of Sencromen. It causes nausea, vomiting. Occurrence of follicular ovarian cysts has been demonstrated. It causes delayed periods or scanty periods. Sometimes amenorrhea also occurs. Contraindications for Sencromen: liver dysfunction or clinical jaundice, ovarian cysts, cervical hyperplasia, severe allergic conditions, tuberculosis, and renal disease. What is the efficacy of Sencroman? The Pearl Index, which is the contraceptive failure rate in 100 women years, is 1.13. So what is to be done if a pill is missed? If a pill is missed within 7 days, the normal schedule is continued with the backup method till next periods. If the pill is missed for more than 7 days, begin like a new user. So the key points: Sencroman, marketed under the name CHHAYA, is a non-steroidal oral contraceptive, also a selective estrogen receptor modulator. It is safely used in women of any age or parity and in immediate postpartum period. It has got the advantage of infrequent dosage as compared to other hormonal contraceptive pills with minimal side effects. Since 2018, Syncroman is provided free of cost in India by the government-run family welfare centers under the brand name CHHAYA. Thank you.